This conference will now be recorded.
We've officially started. This is the AnCan Blood Cancers virtual support group. I am Michelle Nadine Baker, and I'm from Kicking Cancer in Heels, one of our partners for this. I always forget to say that. And I welcome you all. I'm in Boston, and I am a blood cancer patient, and I have chronic lymphocytic leukemia in treatment and doing well. And I'd like to see who needs some time this evening. Let's hear from people first who need time, and then have everyone else introduce themselves. Sally.
I may or may not need time depending on how things go, but I'm Sally Torgeson. I have multiple myeloma. I've been diagnosed since 2018. I live in Zionsville, Indiana, and I feel great.
You look great. Jerry, you're next on my screen.
I need time.
Okay.
I had a hellacious 2 months. I'll go through it later.
Okay. And Jerry, you're in Detroit area?
AML.
Okay. Lou.
Hi, Lou Sears in the Kansas City area, and I have multiple myeloma, and I really don't need any time.
Well, I know you were updating people a little earlier, so if you do need some time, please let us know, and I have some notes to ask you about. So anyway.
Okay.
Welcome, Lou. Judy.
Judy Williams. I'm
Just ready.
Frisco, Texas. I have CLL. I am taking pirtobrutinib and have been for a year. Much.
Do you need some time tonight?
Not really.
Okay. I'll ask you a little about yourself later. Okay, great. Jim.
Jim Marshall. I'm here for my sister Susan, who has multiple myeloma, Tulsa, Oklahoma, and I've got stage 4 prostate cancer within and with the lymph nodes. So, and do I need some time tonight? Yeah, I have an update.
Okay, thank you. It sounds that way. Linda. Invisible Linda, would you like to introduce yourself and let us know if you need some time to share information with us? Okay, we'll come back to Linda. Perhaps she's stepped away for a second. Or Belle.
I'm Belbitz Winstritz. I'm located in Germany, and I have 2 cancers. I have CLL and Waldenström, and I actually need a little bit of time. I have a little bit of an update, not much.
Okay, thank you, Barbell. I don't know if that's where you were or somewhere else where it sounded like someone was crashing dishes, but.
It was Lynn. Lynn's in big trouble.
Mary, welcome tonight. Good to see you.
Yes, same here. Mary Lou. I have MDS. I had a recent stem cell transplant in September, and I'm doing great.
Wow, that is great to hear.
Yeah, doing very well.
You look good.
Thank you.
Like your hair's looking like it's
my hair's coming in. My hair is coming in. Yeah.
Okay. And Mary. We have our Mary Lou and we have Mary.
Right. I'm doing fine. I don't need any time.
Good to see you. Your hair's looking good too, Mary.
Thank you.
Okay. Lynn in Texas versus Linda. We can't hear you, Lynn.
I muted you, Lynn.
Are you hearing me now?
Yeah, absolutely.
Okay. Did you want to see my hair too?
Hey, you told us your hair is growing in again. Very nice.
I
May
have
do.
more to, when it comes to my hair, the eyebrows are probably the predominant and always have been the predominant feature. And
Do you need
I have an appointment next Wednesday with my oncologist, so I'll have to give you an update after that. Nothing to report otherwise.
Okay. Dr. Awan?
That is correct.
Have to find out. You have to let us know how you're doing in between now and next month on that. And about your,
I'm good.
you have anything that, do you need any time later to talk about what you might be asking about?
Well, I could probably talk a little bit. If you need
Okay.
somebody to fill a little gap here or there, Judy knows I can talk.
Well, how about with your
Nan-
guitar? You can always sing
Nancy,
to us.
Nancy might want to sing along with me. I'll get my guitar out.
Where did Nancy go? There she is. Nancy, hello. I knew you went somewhere.
Hey, I'm Nancy. I'm in Texas, just a little bit down the road from Lynn. I'm in Abilene. I have CLL and I'm doing really well. I don't really have any need to take any time, so I'll just be here and smile a lot.
I know we lost Leslie. Hopefully she'll come back. I saw her pop in and then pop out. Linda, here you are. Hi, Linda.
Hello, hello. I was having trouble here. My name is Linda. I'm from Connecticut. I'm diagnosed with Schnitzler syndrome and MGUS. I just started biologics a week ago yesterday, and we'll probably start chemo in April is the plan right now.
Would you like some time to talk about, share with us more? Because what we do, the way we do our meetings, if you haven't been to an AnCan meeting, is we all introduce ourselves and see who would like some time so that we can kind of, in our brains anyway, try to figure out how much time each person needs so we can fit within the time. So I know that I'm sure a lot of us, including myself, would love to hear more about you and your journey thus far.
Okay.
So, okay.
Okay.
All right. Welcome. And now I see Ruth.
Hi.
And Ruby. Hi,
I
Ruth.
was going to say Ruth, and Ruby is making a big bunch of noise. I'm sorry.
Ruth, I was just explaining to Linda, another new member here tonight, that the way we run the meetings is we introduce ourselves, where we're from, and share if we would like some time. Oh, there's Ruby.
The dog would like time.
Okay, calm down.
The dog does need time, and Shelby will too.
I apologize. I just walked in, and so she's going a little crazy. I'm sorry.
That's okay. So we basically, since you're
myself.
new, we would love for you to share with us after we're going around to everyone. So you will need time, but we just introduce ourselves in the beginning and say if you need time to talk about things or not. And because you're new, I would think you and Ruby will need some time to speak. Okay. And is your husband joining us tonight? Okay. So you're representing you and him? Okay. You're two people tonight then. You are MPN and multiple myeloma. That's a lot. Ruby can be one, okay? Okay.
Michelle, may I make a suggestion?
Yes.
If everybody'd go up to the right-hand corner to the little dots and say, edit your email and put your diagnosis with your name, because it gets confusing with this many people to remember who's MM, who's CLL, and who's something else.
That is a wonderful idea. Thank you. So if everyone could go up and in the chat,
No, in your window.
In our windows. Okay.
At the three little dots, just click on it and says edit your name.
No, it doesn't.
Yeah, mine does not. When
Mine does also not.
Mine does.
I can only shut off the microphone,
you know what?
raise my hand, and shut off the camera.
Does anyone else have a MacBook? That's what I have.
I have a Mac.
I have a Windows.
Up in the right-hand corner of your name.
And it's letting you do your name?
Up your picture. Go up by your picture, up in the right-hand corner. And there are
Right.
three dots.
Yep.
And it's where you rename yourself.
Oh,
Mine's not giving me that prompt.
Mine neither.
If you're on iPad, it may not. I don't know anything about iPads.
Well, Michelle, we know you're CLL. You are the CLL queen. So that's like established.
Thank you very much.
Yes, I think while other people are doing that, and of course you don't have to do that if you don't want to, especially since this is being recorded, we can go to Linda.
Yes. Linda, since you are one of our newbies this evening.
Okay.
It's so nice meeting you. And I'm also in New England. I'm in Boston.
Oh, okay. Down the street.
Exactly. And we also have one other person here from New England, Mary Lou. So welcome.
Springfield.
Okay.
Welcome to our group. And everyone else, as you've been hearing, is from all over the country here and other countries, Barbell. So thank you for joining us, and we'd love to hear more. If you want to tell us what you're going through right now, you just mentioned you started a biologic. Some of us are on the same ones across cancers. What did you start on?
Okay, so just to give you a little bit of background, I started getting sick last April with a very, very bad case of, probably the worst case of flu that I thought I've ever had in my life, with body aches and breaking out in rash. By the end of May, they had diagnosed me with what they thought might have been sarcoidosis. By October, we started a treatment plan of corticosteroids and hydrochloroquine, which was not working for me. I subsequently, between losing hair, gaining weight, being sick, by the time I saw the hematologist in October had diagnosed with Schnitzler syndrome with the MGUS. The MGUS Andalia I've had since 2019. In December, we stopped all the treatments because I was just getting very, very sick and having allergic reactions. And in January, we determined the course of action right now would be to start with the AnCan, which is the biologics. Once that was approved by the insurance company and everybody, we started that a week ago Wednesday. I do have severe body aches, like my bones hurt. That was one of the things I was complaining about early on, is that my bones just really hurt. And because I'm so physically active, like I hit the pavement every morning, I do Tai Chi and Qigong. So just not being able to do those things. And I kept saying to the doctors consistently, the team I was working with, if you could just tell me why my bones hurt, I'm good. If you just tell me that, and I can muddle through everything else. And then when my labs, we're doing labs every month. My white blood count, my red blood count, and some of my other numbers were just consistently dropping. And so, like I said, we started the AnCan last Wednesday, a week ago Wednesday. I don't have a whole lot of relief from the bone pain at this point. What I don't have this time around, which I'm happy about, is the nausea and the vomiting, which is what I had all last summer into the fall. So I'm happy not to have that. But my appetite, I feel as though I really need to eat something. And I'm not a big eater. I'm a vegetarian. And so I really feel like I need meals, not like a bowl of cereal. Like I need real food, and which is a little unusual for me. So I'm thinking that's from the AnCan injections that I'm doing. I'm getting better, I think, with the injections every day. But once I do the injections, probably the first 45 minutes, I just need to sit down or lie down. I still have a lot of fatigue that is not going away, and I understand that's one of the side effects from the disease itself and the AnCan. In April, I have a couple appointments. I'm going back to the pulmonologist for follow-up later this month. I see the hematologist next month, and then I see the treating physician next month. I'm having a ultrasound on my liver because my liver numbers seem to indicate that there's a problem there, so they're doing an ultrasound for that. I've had a lot of X-rays on the joints, the knees, shoulders, spine, and there is some disease in those. But my bone marrow that I had in October indicated there was no cancer in the bones at this point. It's just the calcium leak and everything else from the bones that's causing the problem. That's my short version.
Michelle, you're muted.
Linda, have you tried Claritin for your bone pain? Has anybody told you about that?
I'm on Allegra, but nobody's told me anything about Claritin.
No, Allegra doesn't work, but Claritin does. I've had multiple myeloma for 6 years. I'm a coach. I coach newly diagnosed and relapsed myeloma patients.
Mm-hmm.
And bone pain, Claritin, because it's an antihistamine and it has a different formulation than Claritin, helps ease the bone pain, but it does not work on muscle pain.
Same for with CLL for bone pain associated with treatment. The Claritin helps.
Oh, okay. So switching from the Allegra, the pulmonologist, I have asthma, and I have a list of allergies. I just have a list of allergies. So, it's the Allegra, the Nasacort, and the rescue inhaler as I need it, and an EpiPen.
Well, probably the Claritin will help as well as the Allegra for your allergies, but it will help with the bone pain, whereas Allegra will not.
Okay. You just check with your doctor.
Yes.
Okay.
If you can just switch them out. Jerry, you had something.
And you can take the Claritin twice, so you take it morning and evening.
Okay.
Even though
I never knew.
Even though
that neurologist came in and said you take it twice a day, without any effects.
Okay. Thank you.
What did you say, Judy?
I said even though it says it's a 24-hour on Claritin, you can take it twice.
And is your as far as your rash, your MGUS and all, is that active right now?
It's active. It comes and goes. I have certain spots on my face that I get it, on my legs and my thighs and my abdomen area, and actually most of my body. But it's not as active as it was, say, last summer or even in the fall. But I'm still getting, I have a breakout on my face right now.
Linda, I'm sorry. MGUS to people with myeloma are different, I think, because what does your MGUS mean?
It's let's see if I could get this. It's monoglutinin unspecified.
That's sort of like multiple myeloma is miscellaneous gammopathy of unspecified origin or something like that.
Right.
MGUS is a precursor to myeloma.
To myeloma, yes.
Right.
So you don't have a precursor to myeloma. Yours is
mine. I have a precursor to the Waldenstrom.
Right.
Oh, that's what I have.
Right.
Arbel has.
Yep.
Oh, okay.
You have high protein then.
I do. Yes.
I have IgM is way too high. It was way too high, but now with the BTK, it's going down.
Okay, and I don't understand how I have high protein, but my numbers are showing that it's a high protein. Like I said, some of my blood count numbers that they look at, everything is consistently dropping. My white blood count. So when I started this new treatment last week, the one thing that she reiterated again is that I have to just be very careful being out. Make sure I'm sanitizing my hands, that I'm if I go into the store, that I'm wiping my hands when I get in the car. Right now, if I'm around somebody who's sick, somebody could sneeze around me, I'm guaranteed to be out for a couple of days. It's just guaranteed I'm gonna have a cold.
Now, is that due to what you're on, or is that due to your Schnitzler syndrome?
It's due. I think it's a combination. How it
is for many of us here.
Schnitzler syndrome, I don't know.
I wear a mask everywhere I go.
Right, I wear a mask everywhere I go. I will admit that I was not doing the hand sanitizing coming in and out of stores, but I'm good about wearing the mask. I have mask in the car, in my pocketbook. But last week, that was one of the things. Matter of fact, I had to sign a form saying that I understood that um, I could pick up something very easily, that I needed to sanitize my hands coming in and out of stores, at home and everything. So I've stocked up.
Can you?
One of the things that I also do, I have just a package of um, of the wipes that, like, for surface wipes, that I keep in my car. And like if I'm going, I take one of those in, because not every store has those.
Right. Okay.
Can you spell the name of your biologic, please? I'm not familiar with it.
It's anacrin. It's Kinneret it's done through Sobi. Sobi, I guess, is the maker. It's Kinneret, and it's called Anacrin, ANKIN. I believe it's ARIN. And it's a special order, so it's through a pharmacist. As a matter of fact, I had a great conversation with the pharmacist before uh, I started it, and the pharmacist, even talking with the doctors and everybody else, the other care providers, it was the pharmacist who really made me understand why it was important with the injections, because I was a little hesitant about doing the injections every day. And I was concerned also just with everything else that I have. Was I going to see a difference? He did say it'd take 2 to 3 months. He talked about the importance of doing the injections consistently the same time every day, around the same time. Where I thought I could do it in my thighs, he recommended the abdomen, and so did the nurse, that I do everything in my abdomen, not in my thighs. So
And
I'm practicing that.
where are you going? Are you going to Dana-Farber by chance, or where are you going for treatment for your?
You mean?
Are you going to Yale Medical Center? Are you,
Okay. I see what you're saying. I'm at Yale. Yeah, everything is doing well. I can say that they had a wonderful team of doctors, from the dermatologists all the way through. Even with the sarcoidosis, like, they still weren't 100% sure. Like, they still kept looking, because I was not responding well. The bone pain was just so bad, the rash, and I just wasn't getting better. I was getting worse. I was gaining all this weight, but I was also getting worse. But they really, I have to say, were persistent in terms of just locking it down. And it was the hematologist, that locked it down after I had the bone marrow.
it's such a rare disease that you are fortunate that they got to the bottom of what was happening.
Yes. And so quickly, so it's been a year. Next month will be a year when I started getting sick. And so when I hear other stories, I recognize how fortunate I am. But I also think it's because I'm here at Yale. I think because I'm at Yale and it's a teaching facility, I think that has a lot to do with it as well.
It does. It does. Well, welcome to our group. We're all
Thank
here
you.
for each other,
Thank you.
and so happy that you're here with us.
So I got a question. I'm reading that alcohol doesn't kill everything for your hands. So what's a good alternative to alcohol?
In other words, like they're saying for the flu, you still have to wash your hands.
Everything I'm reading is alcohol really isn't really that effective.
Oh,
So what do you guys use? Does anybody use anything different?
I know I was in the hospital with C. diff, and they had all these big signs saying, wash your hands going in and out. And so a lot of the nurses were just using the hand sanitizer. And one of the doctors just grumbled under his breath, that won't do it. They mean soap when they say soap.
Yeah, but I'm thinking in your car. So, I want something in my car that's
Oh,
better than alcohol. I get washing at home. That's easy. But going from store to store and doing stuff for gas, I do the rubber glove for gas, because gas is probably the worst thing you can
You know,
touch. but
You know, I've done this and I wouldn't, yeah, I wouldn't suggest this, but sometimes I just use liquid soap when I'm desperate in my car. And it ruins, I mean, it ruins your hands. It's going to ruin your manicure, Jerry, but it sounds crazy, but use it, rub, and then I have a towel and I put, from a bottle of water on the towel to rinse, it's not the best because you're also not getting water the whole time when you're rubbing. So I don't know, Nancy, can you ask your home physician what he says about that? But she'll be right back. I feel like we're on a game show or something, but she'll be right back.
On the C. diff, that they recommended that you use bleach, and bleach. I use bleach wipes when I had that.
Oh, bleach wipes will work then. Okay.
You don't want to use those on your hands, really.
No.
Right,
So what do you do?
I mean, I got horrendous dry skin.
Surfaces.
Transplant.
You know, Jerry, this is a crazy idea too. What if you had them in your car? So when I pump gas, I will use a wipe between me and the nozzle. But what if you wore like a surgical glove so your hand doesn't get it?
I have the rubber gloves. I mean, or I'll use just regular winter gloves. It's fine in the winter. I'm just thinking summer and stuff like that. Just because you touch so much stuff, door handles, all this stuff.
Rubber gloves are probably the best alternative.
You get some nice hot pink ones.
Yeah.
They go with your bathing suit.
I get enough shit with a mask. I mean,
I know, and that is interesting how they're saying that now. I'm glad you brought that up. I bet you bleach would be pretty bad on your hands, straight on bleach or the bleach wipes. That just wouldn't work.
Yeah, I don't think, I think your problem would be solved.
And it says that alcohol will kill germs on surfaces and your body.
Yeah, but they've been saying about with this flu that it's not good enough.
Well, maybe it's a virus instead of bacteria.
No, I think that's part of the problem. Michelle, I see Ruth is back.
She is. Ruth, hi. Would you like I saw that Danny was with you and now he's not, but would you like to share tell everyone, the version, your short version of your story?
A short story of my 67 years. Sure, I'm happy to join you. Thanks so much for inviting me, Michelle. I will keep it really short. So I've had a rare blood cancer for 30 years. This marks the year of 30 years. It's what we now call MPNs, myeloproliferative neoplasms. When I was diagnosed in 95, it was just called a blood disorder. I didn't have cancer, and it started out as ET, which is essential thrombocythemia. It progressed to polycythemia vera, which is PV, and now it's myelofibrosis, which is kind of the dreaded myelofibrosis. It's the progression that nobody wants. The next progression would be AML, which, of course, is not something that any of us want to have to deal with if we don't have to. And yet science has gotten so much better that whether it's, myelofibrosis or AML or whatever it is, we've come a long way. So I'm a health and science writer, which means I've been in the health space for years. I first I kept my story to myself for the first 20 years. In fact, for 25 years, I didn't know anybody else who had what I have, which is, a subject that's really of interest to me, that, how we all choose to deal with our disorders differently, or our cancers differently. Some people need to shout it from the rooftops. And for me, I didn't want to tell anyone, except a very few people very close to me, because I didn't want to be looked at that way. I know I can say that to this group. I didn't want to be looked at as a cancer patient. I didn't want to be looked at as someone, oh, I'm sorry, how are you feeling today? I didn't want to talk about my health. When I got together with family and friends, I wanted to talk about everything else, right? So I kept it to myself for a long time. In the middle of COVID, because I'm a health writer and I wrote for the New York Times for about 6 years on and off, I pitched a story to the New York Times about MPNs, which as the sort of elusive blood cancer. And I did that because the angle to the story was how cancer can be a good label. A cancer label can be a good thing because nobody was putting money into MPN's research or education until WHO, the World Health Organization, decided to reclassify it as a cancer in 2008. And then all of a sudden money started flowing and interest research started flowing. So I thought that was very interesting. So once I told my story publicly for the very first time, and that was 2021, in the middle of the pandemic, a lot of things happened, and a lot of people started coming to me and thanking me. Hundreds of people posted on the New York Times site, and people thanked me because, not because I'm like amazing, but because they had something to share with family and friends and even their physicians that they didn't. When you have a rare cancer or rare disease of any kind, people don't know how to explain it, right? So this group understands that. So it's kind of that, oh, but you look fine, so we don't really know that you're really sick, right? The fact that I missed my twin grandson's second birthday party because I couldn't get out of the recliner that day. I don't know that anybody ever knew I was really unable to move that day. They just thought, oh, Ruth isn't feeling well that day, you know? So we go through all of these things, number one, as an invisible disease, but also as a misunderstood cancer. So my whole thing in my world, and then I'll let you jump in, is the difference between chronic and acute cancers.
So
how, because of scientific advancements,
Ruth, we're trying to just share about, I would love for you to share that, but right now we're really trying to share like what we're, I'm sorry, like more like what we're personally going through today with you know, like who you're seeing, how you're feeling today.
Okay, thank you for that.
Sorry. And I'm sorry to interrupt because
no, it's fine.
But
I'm glad you did because I didn't know.
Yes,
so
you look so fine. I mean, we all, yes, of course. And you do. And
well,
everyone
for you,
here
but that doesn't mean that describes how we feel inside.
Right.
Okay, so two things, and then I will let somebody else jump in. So two things. I feel great. I've been in a clinical trial for 5.5 years, so I'm a huge proponent of clinical trials. My doctor calls me a poster child for the clinical study because I've had an almost complete not remission. There's no such thing as remission. But as she says, I've had an almost complete response. And that's very, very unusual. So I feel great, except the conversation that just took place earlier. I'm very careful with masks and touching and et cetera. I just had pneumonia on and off since October. I just couldn't shake it. Every time I got better, it got sick again, relapse. I'm on immunosuppressant drugs, Jakafi, that just makes me really susceptible and affects my immune system diseases. So the second thing I'll tell you, and then I'll jump off. So I'm here with two hats. I'm also here as a care partner, which I'm not used to that tag yet. My husband was diagnosed with multiple myeloma in December, and we're just starting. He's only 4 weeks into treatment. So I'm playing that role as well, which while I'm really aware of the needs of care partners, it's very different to kind of play on both sides.
We do.
So that's me.
We do have a care partner group too.
And Ruth, I'm so sorry you're going through both now, and which is ironic, and that being a health and science writer and reporting on multiple myeloma is both of us have, and then it strikes at home.
Yep.
But we'll
be fine. We'll go through it.
I mean, we have people in this group, as you didn't hear, that have multiple myeloma. Those of you who have it, Sally, Lou, and Mary. Did I miss anyone here with multiple myeloma? And Sally and Lou are myeloma coaches that I had mentioned to you. They are incredibly knowledgeable. And if you have questions this evening, or if you want to share a bit, or maybe they have questions to you about Danny, that's her husband, ask them, please. And I'm sure they have questions for you right now. By the way, Jerry, I don't know where he is on your screen. He's in my upper right-hand corner. Jerry, if you can wave. He has AML. So you were talking about AML. So, and as you see, we have many different blood cancers here represented. Mary Lou,
you're welcome to contact either Lou or I after this, email, call, Zoom. We're always willing to help.
Thank you. I think we're so early on that I don't have specific questions. I did a lot of research. You know, I feel like I have really good information. What I don't know yet is what I don't know. But thank you for that. I
The
really
most
appreciate it.
important thing you can do in this early stage as a newly diagnosed patient is make sure you are seeing a certified myeloma specialist
Yeah.
at a big research hospital.
Yeah, no, I feel that way with MPNs as well. That's the first thing I tell people. You know, seeing a local hematology oncologist isn't enough. You need a specialist. So the first thing we did is go to a myeloma specialist where I have my MPN specialist. We got the diagnosis there, had all the testing there, but he's getting treatment locally. So it's a perfect match. Yeah. Thank you for that.
Memorial, are you going to Memorial Sloan Kettering? Is that where you go? I'm sorry.
Yeah, Weill Cornell.
Weill Cornell.
Weill Cornell in New York. Yeah.
That's great. I don't know if you want to share his doctor's name. I'm unsure if some of us may know it. I don't know. But that's great that you got into one so quickly. I don't know how you did that, but that's wonderful.
We got into it so quickly because I was in my hematologist's office, hematology oncology specialist, MPN specialist at Weill Cornell, and mentioned that my husband was in the middle of what we think is diagnostically multiple myeloma. And she went on her computer and in 30 seconds reached out to the head of the myeloma department and said, you know, what do you think? And he said, I'll see him in 2 days.
That's
So
wonderful.
all of that, as wonderful as that is, it also accentuates the inequity in cancer accessibility. I mean, I'm thrilled, but we recognize how privileged we are.
Yeah. Well, yes and no. I mean, you had to pay a price to be that privileged. So that's just.
Oh yeah, and I have to go 3.5 hours each way to New York every 3 weeks. So it's not without hardship, but I still recognize that everybody doesn't have that ability.
Yeah, I know. Well, I'm so again, if well, so what is Danny on for treatment? I'll ask it because I know that I'm unsure, but others may be
Right.
curious.
So the newest treatments are to do either a 3, you know, triple or quadruple, 3 or 4 treatments, depending on how aggressive they want to be. So they started him with 3, you know, with daratumumab and a high dose. Sorry, I wasn't thinking about that. A steroid, high dose steroid, high dose steroid, and Velcade. Sorry.
What did you say,
I said
Sally?
Dex, Val, and dexamethasone.
Right, and Velcade, yeah. And then they were going to add 4th Revlimid, and they decided let's hold off to see how he does first with the first 3. And I get that because I've reported on multiple myeloma. I reported on a story on multiple myeloma the day that he was diagnosed, so it's a little bizarre. But so I do also recognize the pros and cons of all of that because there's some conversation among specialists about, okay, we might get a better earlier response with all 4, but if you relapse, then we don't have something to go back with. So if we're on 3 and we don't do well, we've got something to add. If we start with a combination of all 4, we don't have anything to add. So they've started him on these 3, and he had his first transfusion yesterday because his blood counts dropped significantly over the last couple of weeks. And we'll see. It's early times.
Ruth, Rick, who's the founder of AnCan, he's here, but not. He's like in between 2 groups at this current moment. But he's wondering what you were on for PV.
So it's been so long, I have to think about it. I was on a 30-year-old chemotherapy drug for like 20 years, which is hydroxyurea.
Yeah.
And I really didn't want to be on it, but I sort of had no choice.
And that was for how long did you say you were on
probably
it?
20 years.
And then what are you on for your
So now, once I was diagnosed with myelofibrosis, I'm on Jakafi, but I'm in a clinical trial, and the clinical trial is a combo therapy. Jakafi combined with a BAT inhibitor, which is called pelabresib. And from what I understand with the study, there are a few people like me who are doing incredibly well, and there are a lot of people who aren't responding at all. So it's kind of iffy whether or not it will ever get as far as FDA approval. I think it will if they figure out what is it about me that makes these drugs respond, whereas with you it might not. So it's a genetic question, I think, and we'll see how long it takes for them to get there.
And did you go straight from drugs, your hydrourea, and straight to this, like any lab?
Well, I went to a bone marrow biopsy that I hadn't had a bone marrow biopsy in 20 years. I've now had 12, maybe 13. But when I went to the super specialist in New York after seeing a local oncologist for years, the first thing she did is said, let's take you off your drugs and see what we see. And my blood counts crashed and I couldn't walk up the street. I went from bike riding, we used to do 10-mile bike rides. All of a sudden, I literally couldn't walk up the block. So the drug did work. That old-fashioned chemotherapy drug, it did work, but it doesn't target the way today's drugs do. So it was damaging my red cells, white cells, and platelets, and has been associated with leukemia. But MPNs has been associated with leukemia too. So again, we don't know. So the first thing she did is take me off all my drugs, and then because I was on a blood thinner and I'd had clots, I've had hemorrhages. I've kind of been like, okay, bleeding, hemorrhaging, clotting, tough to manage when you're on that line. And so they took me off my drugs. My blood counts went down, and so she said, I think I have a perfect clinical trial for you. So I never had an in-between time. I went right on Jakafi and the study drugs. It's been 5.5 years.
And as you said, it hasn't been approved yet, so it's still in trial then.
Yeah. Oh yeah. I'm in an extension trial.
The reason some of us are interested is we had another moderator previously, I may have shared with you, he had polycythemia vera.
Yeah.
And had progressed.
And I'm sorry for your loss.
Thank you. Thank you. Ruth, thank you. Thank you to you. And we're all happy to see Ruby and meet her during this meeting. Please share when you want to in this, like if you have questions or you have a comment of what you've learned. So let's move on to, I'm just looking around. So Jerry, would love to hear from you.
So I was really feeling good and everything, and riding, and I came back and told the guys, hey, I think I'm peaking. I'm really feeling great, and went out with a ride. It was 20 degrees, and I came back, and that day I felt exhausted, and I couldn't go up the stairs and everything the next day and everything, and got sicker and sicker, and doctors came back and they thought I had pneumonia, and they prescribed drugs for me for pneumonia, but I wasn't getting any better, and I kept on getting more and more exhausted to where I couldn't go up the stairs, just total exhaustion. And they came back and said, took chest x-rays, and they said, you got pneumonia. And so went through that, but I wasn't getting any better. They came back and said, we think your pneumonia, it's spreading, it's getting worse now in both lungs. You got to go to the emergency room. So I go in the emergency room, and of course you've got RSV, you've got COVID, and they're stacking the people up like cordwood in the hospital. I couldn't get into a hospital, and they come back and they say, you got to wait 4 or 5 hours, and people are just, it's a mess in there. So they came back and they finally got me in because I am very, I told them, then you play the cancer card, basically, to see if you can get ahead of the line. And they said, we can probably get you in earlier. So they come through and do all this stuff, and they come back and say, you don't have pneumonia. Or if you did, you're well. So I was in the hospital for about 5 days, and I went through 45 tests. So they came back and said, we think it's your heart. Then we think it's your lungs attacking yourself because of the chemo and everything. Then they go through all this stuff. And meanwhile, I start breaking out in the rash that I had when my cancer reappeared. So I think, oh God, the cancer's back, but yet my platelets and everything are good and everything. So I don't know what's going on. Go through all this stuff, and I have a wicked cough, and I'm coughing like nonstop for weeks, and it's going on, and they can't tell me what's wrong with me. And in the end, out of all that stuff, they come back and say, we don't know what's wrong with you. And they said, finally, the head of the bronchial people came back and said, you know something? We think the people that had pneumonia and that have gone through the immunosuppression and everything, they develop this these weird viruses that we can't really detect. And it's going to take you at least 2 to 3 months to get rid of this thing. And they sent me home. But meanwhile, so what happens is after I really get tired, I'm feeling really bad and everything. I decide to go get bagels at a bagel place, and I pass out, and I hit a car and total my car.
Oh
And that's right before I went to the doctor, and my wife goes, "You better go to the doctor. You really something's going on," because I passed out, literally passed out, and I woke up and a lady standing in front of me. I hit a truck, and just I'm trying. I come to and I got coffee all over me and everything. And the lady, she was a nurse, who was standing in front of my car and said, "We better get you an ambulance or something." And tore the wheels off my car and everything. No damage to her car, big huge truck. But yeah, I totaled the car and everything because I totally fainted. And I came back and went to the hospital that within maybe 2 days after that, when they came back and said, "You got to go to the hospital." And
So,
to this day, I still don't know. I'm coming back from it. I mean, it'll be 2 months, 14th of this month. But I haven't been out of the house with it, other than going to doctor stuff. And finally, up to being able to go upstairs, but they don't know. No idea. I've had every test imaginable.
so did you say they said there's something, it's something that's hitting people on immunosuppressants? Did I hear you say that?
We see a lot of, they said they saw, uh, they see this with people that have had pneumonia, and then another, another, like another virus comes in that they can't really, because I guess there's so many viruses that are not detectable or whatever, or that they can't identify, come in, and they said it typically will take anywhere from 6 to 8 to 10 weeks for it to clear your system, and there's nothing they can do. They
Yeah.
just said just sit it out. So I've been sitting there, I've watched every Netflix movie imaginable, and you just sit on the couch and you just can't. I couldn't do anything. I couldn't even go. You get up, and it's like, ooh, it was like going through chemo again, going all through chemo again with the exhaustion and the no appetite. I lost probably close to 15 pounds.
It doesn't sound like any way to be on a diet.
Yeah, it's it's a COVID diet again.
Ruth, Ruth wanted to comment.
Yeah, so my hematology oncologist in New York, who I literally trust with my life, said to me she has had several patients like me. I've been on and off walking pneumonia since October, and now then it developed into traditional pneumonia in my lung just the past few weeks. And she said whatever's going around, the viruses and the bacterial infections that are going around, she has seen more immunocompromised people than she's ever seen in her career get that deep cough, pneumonia kind of cough, that lasts for months, not weeks, but months. And so I asked her about it. I said, why do you think it is? Is it that the viruses are more viral than usual? She said, actually, I think it's because we went through COVID. We all wore masks. Those who are immunocompromised like us continue to wear masks. And so we're just not exposed to viruses the way we used to be. So that's her take I'll share with you. but
Yeah,
it's been
'cause
months,
it's
and we're not the only
it,
ones. I will
it,
share one more thing.
sure.
So when I had such a deep cough, as you know, it was painful, but also such a deep cough I couldn't stop it, right, to talk. I just couldn't even talk. And the only thing that calmed it down was a shot of bourbon before I went to sleep. So I told my doctor that, and I thought she was going to laugh at me. And she said, "You're the second person who told me that.
You know
If
what
it
also
works,
works?
go for it."
Guana gummies.
What?
Guana gummies. So what I've been doing is taking it's a low dose, like 5 milligrams THC,
Yeah.
with 3 to 4 milligrams of CBD,
Yeah.
and that calms it down
Okay.
to where what I learned is the cannabis stuff is like it's basically like an opiate,
Yeah.
because I was using my cancer opiates and just
Mhm.
taking taking a tiny little piece and chewing it
Yeah.
before I go to bed so I could sleep, because it was like waking up. I'd wake up, it'd be like going through 40 rounds of Muhammad Ali when you're coughing
Yeah.
for 18 straight
You go to
hours,
sleep.
a deep cough. And
Yeah.
there's, they give you those little stupid round pills, those clear pills that's supposed to take care of the cough, whatever it is.
Pearls.
I came back and said, throw those out. It said,
No, bourbon worked for me.
those are useless.
What did you say, Ruth?
Hey guys, I
Yes.
want to say I've been immunocompromised for 6 years. I do not wear a mask. I fly all over the world. I have not been sick.
Wow.
I do use hand sanitizer when I'm on a plane or in the grocery store. I get IVIG every 4 to 6 weeks when my um,
What's IBIG?
IgG is below 400. And the only thing I drink when I have a cough is elderberry syrup and maybe some white willow bark. I'm also doing a lot of herbology, so that's something separate. But everybody is different. There is, you can't say that everybody should do this and everybody should do that. You've got to know what your own body is doing, especially us weird immunocompromised people. So just saying, I have not been sick, really sick, except maybe once in 5 years.
So I said that just for the record. I've been saying that for 2 or 3 years, like I haven't even had a cold. And I eat a really healthy diet, and I drink my turmeric tea and all that. So I'm with you. You have to do what works best for you. But yeah, maybe I'm just overdue.
Yeah, I had COVID once, and I haven't had anything else until this thing. This thing just.
Well, Sally, getting back to what Ruth said, her doctor said about people wearing the masks, we're not getting building our antibodies. So you probably have been, well, those wearing masks, we have not. So
That's very
in that
possible.
case,
Yeah. But I have no immune system to set up antibodies.
Right. So yeah, you know.
But I get all the antibodies from the IVIG.
And then the next question is what about this new the pneumococcal drug? Sir, there's a new, they have Prevenar, they have this, they got a new one out that covers 8 more
I had that a year ago.
strains.
how many? I'm trying to remember the number.
It was called Pneumo something 23. I had.
No, there's another one now. There's a new one.
Pimgarda.
Yeah.
No.
I've
It has
had.
8 more.
You take it at 3 or 4 months.
Yeah.
Isn't Pemgarda something else, or is that one?
This is a one time, just like the others, and basically insurance doesn't cover it. It's like, I don't know, $300, $340.
Mine was covered.
This isn't covered.
Pimgarda is mainly for COVID.
I think he's talking about something else, because Pemgarda is different. Pemgarda's against COVID.
No.
Talking about the new pneumonia one.
There's a new pneumonia one. It just came out, and it covers 8 more strains than any of the others. And so I figure I'm going to do that once I'm through this thing. just to give me extra protection because.
When's the last
Jerry,
time? Go ahead.
Jerry, you asked a while ago what is IVIG?
Yeah.
Immunoglobulins. An infusion of immunoglobulin.
It's
Oh,
for
that's the
those
new.
that
Isn't that the new COVID thing?
No, it's
Oh,
it's IV immunoglobulin. It's the serum from 2,000 other people that is mixed and given to a patient every 4 to
to
6 weeks.
use to boost your immune system for those that are having
Have
problems
one.
with infections.
Right.
oh, okay. So that's probably for you guys because you're constantly fighting. Because yours is chronic. Mine was acute. You get what I mean?
So,
So I don't think
in
that's
the way
available to me.
they test your all of your IG levels
Yeah,
to
see, nobody tests me for
determine.
anything. I don't get tested for anything now. Basically, with AML, you're either you're done or you're dead after a stem cell. Really,
Ruth, I
there's
saw
no.
your caregiver walk behind you a while ago.
He was
You need to
next to
be
her.
sure he doesn't fall down.
Jerry, the newest pneumonia vaccine was a 2024 and it's a pneumonia 2021, and that's what I had.
I thought there was a 23 or a 28 one
Hold
now.
on,
Brand
I'm just
new.
looking.
Hold
It's
on.
23. I'm sorry, it's 23. And I just got it off the CDC website. And you get 2 of them, one every 6 weeks.
I only got one of them.
I got 2. Maybe it's because I'm older than you are.
2 for the price of 1. uh,
I'll find it.
okay, so I'm sorry, Jerry. So what now?
I just gotta sit it out and wait it out. I'm getting better. It's just incrementally. It's
Did your mind go back to like dark places?
oh yeah, particularly with the when I developed all the petechia, all the stuff, and then they came back and gave me, and then they came back and said, well, we're going to give you steroids to get you over the hump, and guess what? The petechia, yeah, it went away, and they did biopsies and all this stuff, and they came back, and I finally started going away because it just came up like in 2 days, like it was immediate petechia, and it covered me all over the place, and it started to itch and everything, and it was a reaction from the whatever the virus was. That finally went away, and then they put me on steroids, and it started coming back again. So I said, I'm not taking steroids. So I said, there's nothing's going to get me over the hump. Forget it. I'll do it on my own because I started developing graft versus host again.
From steroids.
Yeah.
Someone just was trying to say something. Just speak up, whoever it was. Oh, maybe
And I
we
don't want to go through that because I developed graft versus host in spring and fall anyway, which is weird. Every spring and fall, I
Oh,
get
still?
graft versus host skin problems again.
And how long does it take to go away each spring and fall?
When it starts to, when spring kind of starts to wear off, it goes away. I'm having it right now. You start to develop elephant skin. It's weird. I've had it when I came off the Jacophy and everything. I've had it. I'm having it now. It's like, and then it's weird. And then when spring starts to settle in and everything goes away, I'm fine till fall. And it's always during that change. And I don't know why. And they can't tell me why.
That's, I know Dana-Farber now has a graft versus, I may have told you, a clinic. But
Yeah.
Does your hospital too? Did you say?
No, not really.
wonder if they do. Oh, you know what? We lost Mary. Oh no, you're there, Mary Lou. I'm still trying to figure out who we just lost someone, but I don't. I'd have to go back and see.
Sally left.
Sally had to leave.
Ever since the stem cell transplant, I've had it, and I can feel it coming on. I just muscle my way through it and put on a ton of Survey with anti-itch.
Have you thought about going somewhere else for that to maybe have a virtual kind of thing? Because they do have, like I said, they have a clinic there. I don't know anyone, but I could find out about it.
They suggest, well, you could use steroids again, and I don't want to use steroid cream because it makes your skin like paper. I mean, my skin's already destroyed from all the steroid creams and all the steroids and everything. I mean, I reach into a bush and it just looks like a cat attacked me because it just destroys your skin. So I just, and you really can't take a Jacopy scenario and start it up because it takes such a long time. I mean, it was hell coming off of Jacopy with the bones and everything, with the joints and everything. It's brutal.
So do you have to titrate up and titrate down on that?
Yeah.
Did you have to, Ruth?
It's like I was an 80-year-old man, 90-year-old man coming off that thing. It's tough on your joints and bones. Just to give you a heads up. It's a tough wind down on it.
Nancy wants to know if you've tried oatmeal baths.
Oh yeah, I do. I've done all the oatmeal. I do oatmeal lotion.
Magnesium.
Yeah, the best. I take tons of magnesium. Best thing I found really is the Survey with the anti-itch. Has been the best.
I'm itching. Sorry, I can't help talking about it. Does anyone else get that? I know I do. See, not like you're talking about at all. Not graft versus host, but the itchy part, like rashes, random rashes. And I use, but it's a steroid, and you just said the steroid creams.
Yeah, I'll tell you, it's really. You want paper skin?
Yes, exactly. Wait, what? No, actually, do you have clobetasol there? What do you have? What are you holding up, Lynn?
Yeah, it gives you paper. It gives you paper skin. So
no, Lynn is holding up something different.
Yeah.
Any of the steroids.
Jerry, where do you live?
I don't know that one.
Pardon?
What is that a steroid that you're holding up, Lynn?
I think so. I've used that, and I've used the corbetasol too.
Which one do you like better, or which one's more effective, I should say?
Corbetasol.
Yeah, it depends on how bad you have it. I'll use corbetasol if I absolutely like when I had the attack. When I came home from the hospital, it was really bad. I used the corbetasol on real selected problem areas, but I use a Survey anti-itch, and that gave me at least 6 hours of relief.
Ooh, that's very good. You're just talking about the over-the-counter stuff.
Yeah.
I also took
CBD. The CBD cream worked pretty well too, but that only gave me about 4 hours.
For itching, I took an oral hydra. I'll have to look over and see what it is. I'll go look at my bottle.
So,
and then also, what's the numbing thing that they give you?
Ruth, we can't hear you.
Lidocaine.
Lidocaine works really well too.
Now this is, and I don't know if it would work for that particular itch, but I was taking Benadryl, which of course I was useless, and even the next day I'd have a Benadryl hangover. Oh. However, a cousin of mine who is a PCP suggested I take, to say the right one, Zantac. Not Xanax, but Zantac.
Zantac.
And in certain times it does help. But of course, clear it with your doctor that you can use it, but it's just the over-the-counter stuff. And and I read about it. It blocks whatever it blocks. It does help as well with itching. Have you tried that when you're
No.
desperate?
Zantac?
Yeah, and I believe, is that for acid reflux or indigestion or something?
Yes.
And what do you have, Judy? Is that what do you have here?
This is hydroxine HCI 25 milligrams for itching. It's a prescription, and it works too.
Hydroxy what?
It's HYDROXYZINE.
Hydroxine.
Yeah.
I have a question. Can I jump in with a question for the group, Michelle?
Yeah.
So I have a question, having a disorder that becomes a cancer for 30 years and trying not to take meds and then knowing I needed meds and then jumping to this med. Like my entire life, I've eaten healthy. I've eaten clean food before it was called a thing. I'm sitting here with turmeric tea, even though I talked about drinking bourbon. That's my life. That's how I raised my kids. No food coloring, no preservatives, all those things. But here I am on seriously dangerous drugs, which are, I'm sure saving my life. But does anybody else struggle with, I go back and forth between, oh my God, I don't want to take one more drug. Okay, this is for itch and this is for pain and this is for this. So I just kind of live with it a lot. Because I don't want to keep taking more drugs. And then part of me feels like some days I feel like, what the hell? I would say an F word, but I didn't want to insult anybody. Like, what the hell? What difference does it make at this point? I'm taking bad drugs anyway. So what's one more? So I don't know if that's a normal reaction, or that's my orientation. I'd love to hear what other people feel.
Just get a big pill.
What I usually do is I'll have it checked if I still need it. And even these additional drugs that we take with the treatment, I always ask if I still need it, like the allopurinol or the aclicovir, because everything that I can leave out is good. Actually, I'm just taking the cancer meds now and my L-tyroxine for the thyroid and Comtrim, but that is against getting pneumonia. And they said there is a certain bacteria which causes this, and if you take the Comtrim, you don't get it.
If you take what was that, Barbell?
Comtrim. That's an antibiotic, but it's targeted. It's not a one that is covering many bacteria. It's mostly because of the lung issue. They say there is a certain bacteria when you get it, it's really bad, and it protects your lungs, I guess. She told me to take it.
And you haven't gotten pneumonia, so.
Well, I had pneumonia before, after the COVID, but it wasn't really bad. I had already pneumonia as a child too, so. Well, but it's not something you have to get. And the problem is because I take a BTKI, you are more susceptible to fungal infections. And you don't want to get a fungal infection in your lungs.
No.
Jerry's proof of that. So, Jerry, was it pneumonia? Is it pneumonia or it wasn't?
They said I had it, but they think I had it. But they put me on a really heavy-duty antibiotic, and they said they took care of it. And they did the scan, lung scan, and they did CT scanning and everything, and they said I didn't have it. But they don't know what the hell it was that I had in my lungs, but it was definite. And they just thought it was some kind of bacteria or a virus. Wow. And they said unless they were going to do a bronchoscopy on me.
That doesn't sound good.
They just said, then I had the head of bronchial come back and say, we get a lot of people that are immunocompromised. You've had a stem cell transplant and everything, and this is common amongst that subset of people coming off a pneumonia, and this is what we think you got. And unless you want to do, subject yourself, and by then, I'm in a hospital. So here's the other story. I'm in a hospital, right, where I'm in a. This thing has one bathroom for all these rooms, no shower. So I'm laying there 4 days, 5 days with no shower, doing the moist towelettes. And I tell you, the moist towelettes don't cut it. It's like a camping expedition. Getting pretty gross. And all I was saying, you guys can't tell me what the hell's the matter with me. I want to go home. All I want to do is go home. But
Well,
because the hospital was so packed with all these people that have flu and RSV, and all of them were packed to capacity. They were getting 80 people a day coming in.
my gosh.
And
Linda
it
has
was like,
her hand up, and I don't know if it's...
they were lining them up all down the hallways with numbers on the wall, And I called around all the various hospitals to try to get in because they said you got to go today because they thought because everybody was misreading all the. I went to 3 different places, with X-rays, and oh God, your lungs are black, and it was all wrong. It was all wrong. And I'm freaking out. And people are throwing up in the emergency room and in the waiting rooms and everything. It was a nightmare, honestly. Wild. It was like going back to COVID days.
Gee, this must be what they're saying about how bad it is.
This was the hospital that just built a huge extension and everything. I said, I'm going to go here because all of them, they couldn't, some of these said we probably couldn't get you in for a day or two. Because it's so bad, because it's such a peak season and people don't get their flu shots, don't get the RSV shots. That's wild.
Linda, I don't know if you had a comment on what Jerry's saying or something to add.
No, I was going to answer Ruth's question because Ruth was talking about in terms of the eating, and that was an issue for me. I'm a vegetarian, and I am very, very strict about how I eat. And last year when I started getting sick, I'm going back looking at is it something I ate, that kind of thing. Once I started with all the treatments, that was an issue I raised with the doctors about what the medication was going to do to my body in terms of how I eat. I met with the nutritionist who made some recommendations of what I needed to add because being a vegetarian, one of the issues was there were certain minerals and vitamins I wasn't getting enough of. But I'm with you 100%. Taking all these drugs, doing all these treatments, I am very concerned about what's going into my body, trying to balance it with how I eat. So I get you. I get you.
Lou, I know you said you didn't have anything to share, but you're in your new journey, and I know that you had gone through some steps with it, but aren't you waiting for CAR T? Are you still waiting for your CAR T, or did you start?
I had my T cells taken through the apheresis process January 8th. And then 4-6 weeks is what they thought it would take to get my T cells back after they're reprogrammed. So I was kind of, checking with the medical team. I'm having labs every other week. And I knew that the bridging therapy that I was on knocked my myeloma numbers down. And normally you would say, yay, but it has to be at a certain level, your myeloma. You have to show evidence of disease. You get cells back. So it's a catch-22. So lately, the last 2 weeks, looks like my number.
Lou, you froze, but I think you're back now. Bless you.
Uh,
Yeah, Lou, we heard you say that the bridging treatment was bringing your counts down. So
yes,
does that mean that the counts got too low to proceed with the CAR T?
yes. So anyway, a week ago when I got my labs, the last lab, it was up, and so it had to be at least 10 on your kappa light chain number to show evidence of disease before you could get your cells back. So that part was good, but my the doctor who is in charge of the clinical trial at KU wanted to have two labs above 10 before she told him to send my cells from New Jersey. So they're ready. My T cells are ready. I just have to have another lab, which is Monday, and I'll find out if they're going to ship my cells. So I'm kind of in that on hold still.
You keep like overperforming on these drugs.
I know. I really respond well to most of the therapies and medications. The problem is it doesn't last forever, and so you know, good and bad. I respond well quickly, but then after a short period, I don't. I have to go through and the lymphodepleting process where they try to make room for the cells, and that happens as soon as I get.
Oh, darn. I didn't hear that last part after cells. Can you say that again? Oh,
Was I frozen?
Yeah, Lou is frozen. Yeah, I was wondering, so everything's hinging now on the blood test on Monday, and if the numbers are up high enough, then they will proceed.
Yes.
Order her T cells, and I'm wondering how quickly would she get that infusion? Would it be next week possibly?
I'm thinking I'll go in the hospital in about 2 weeks.
Okay.
I have to have other things done, a bone marrow biopsy. This will be number 31 for me. My
You're the
30,
champion, Lou. You're the
hey,
champion. I don't.
31.
I
I'm
don't know
right
how
behind.
to.
I'm right behind you. I've had 3 bone marrow biopsies. You've had 31.
Yeah, I thought I had a lot with 12 or 13.
How
Wow.
do they have? Where do they
It'll
draw?
be 31. I told them when I had my 30th a month ago, I said, I think you guys should give me a cake or something.
Yeah.
But where do they
No, I
draw?
think
With
they
their
should.
neck.
I honestly think all of the technicians should have to have bone marrow biopsies. That's what I think.
that's what I ask them when they say it's nothing. It's in my head. I'm like, have you ever had one?
And you know what
Yeah,
happened last time I said
I
that?
never.
Last time I said that because I'm a huge proponent of, yeah, exactly that. The doctor said to me when I was in med school, and this is a doctor I adore, he said, when I was in med school, I made $50 by being the person who they practiced bone marrow biopsies on.
Woo!
So, yeah, but yeah, that's a lot.
$50
That's
a week,
fun.
not worth it.
$50. Yeah. How about $5,000? Not 50.
Maybe.
Maybe they should have had an auction for how much they would pay him to do it.
This was a long time ago, it wasn't
Oh
yesterday.
my
$50
gosh.
was probably a lot for a med student.
So, Lou, how long do you stay in the hospital?
7 to 8 days. They don't count your day you receive your cells. That's day 0. So day 1 is actually your second day in the hospital. So
And
I
then,
didn't know that until I learned that at the last stem or the last CAR T that I had, and I was like all packed, ready to go on day 7. And I said something to the nurse or doctor. I said, "Well, I get to go home today, right?" And they were like, "No." So they don't count your first day. So I learned that.
Then you have to stay pretty close to the facility to go back
We
within 30
yeah,
minutes.
we live in a suburb of Kansas City, and KU is just across the state line in Kansas. Not very far. It's in the Kansas City metropolitan area, and we live in an area called Lee Summit, Missouri, and it's like a suburb of Kansas City. So it's about 30 to 35 minutes from the hospital. So they let me go home and monitor me, and I have to go back. You know,
Right.
the CAR Ts, you have to go back every day for a couple weeks for blood work, and they check on you. But after the first 2 weeks, typically, because this is my CAR T number 3, um, they typically will monitor you after that, after the first 2 weeks, about 3 times a week for the next 2 weeks. And then after that, you don't go in as regularly. You know, it's like every 2 weeks or something.
Wow.
So
You're
you know, what's interesting and why I really am a proponent of support groups is I'm in some myeloma groups. And I don't know, Michelle, if you know Dana Holmes, but she has several blogs, you know, one for CAR T, one for myeloma patients and caregivers, you know, things like that. I'm in her support groups, and it it is amazing how much support you can get from others who are in the same clinical trial and at different places. You know, I got to talk to a guy who went through uh, this quintessential clinical trial that I'm starting at City of Hope in Southern California, and so I got to connect with him because you know we're myeloma coaches, and one myeloma coach tells another one, "Oh, there's a guy in our group that went through it. Would you like to connect us?" I mean, it's amazing, you know, how you can connect with people. And then in the other support groups that I'm involved in, they're more specifically for leukemia and myeloma. The uh, the people that I have been connecting with are about the same place where I am. You know, they've given their cells, waiting for their cells to come back. So we're all like, "Did you get your cells? You know, keep us posted. We want to know about side effects." You know, so we're all kind of trying to support each other, and it's amazing. You know, that's why I'm all about support groups. You know, I think you can learn so much and get support from each other.
this Dana Holmes, it's a site. She has a website that has different like spots or
Well, myeloma, and I think there's people with leukemia as well in some of the groups, but there's a group called I think it's for CAR T and people who get stem cell transplants. So she has a group there that's particularly the interest, you know, of the people that are on that. And Dana Holmes is amazing. She has several doctors who are also on her blogs, and they will provide information. There's a Dr. Richter who is from Mount Sinai in New York, and he is always popping in, you know, to the groups and sharing information about clinical trials and studies and things. So you know, when you know it's a reliable and knowledgeable you know group, then you know that the information you hear is good information. So
it's very true. It is. And that's why it's always good to, well, that's why I know I and Ruth, we always quote doctors, specialists, That's why it's good for us to all with them. Lou, I just want to say you were a miracle here. And also you're a blessing to everyone because of all these trials and now your third CAR T and to see you. And you have such a wonderful outlook on things. And I
Hey,
just want to say thank you.
you know what? I always say I can't do this on my own. I mean, I've always been a person who has been very optimistic. My outlook is positive more than, once in a while, you get down, but I'm not a person who's ever stayed down. And so for the people that I coach or people that I talk with, if, if we can help someone else feel that they can have hope or maybe give them an idea of something to talk to their doctors about, I think that then we're doing what we need to do. If we can help others, to me, I have a teacher's heart. That's who I was for 39 years, a reading specialist, working with kids, but I also worked with teachers about reading instruction and providing professional development and things like that. But, I think I continue that on with what I do in support groups or our local support group as well, is I teach. I continue to teach. I want people to understand treatments, the diseases, for the blood cancers. And I feel like if I can do that, then that's why I'm here, you know. That's why I'm going on 12 years with
I look at it that
myeloma.
way too. It's a purpose
Yeah.
and perhaps that's how I don't know if does anyone else feel this way? I almost feel like I at least can justify why I have what I have.
Yeah, totally.
Well,
Something good can come, you know, from helping others, even though you have this, crappy disease. Nobody wants it. Nobody wants to have a blood cancer. But if you can help some others along the way, then that's a big plus.
We made some
absolutely.
wonderful friends too.
Yes.
That's right. Absolutely.
I also think, can I jump in for a second? I also think that people like you, or I know if I can speak only for myself and Michelle, because I know Michelle, we can serve as symbols for inspiration for other people who are more down legitimately. They have reasons to feel down, and when they see somebody who's pushed through for a lot of years on a high note and in a very positive way, I think that really serves to help other people. It's not just information education, which of course is so important, which I do as well. I feel like it's inspiration just to be, I'm with you. I've been positive all my life. I also think that anybody can get hit by a truck tomorrow. Therefore, it's on all of us to live every day like it's our best, not necessarily our last, our best. Like, what if today's the best day you've got? Live it, live it, right? But that's true for everybody. So I think people expect people who have cancer to be different, to be down, to be depressed, to be struggling, and we all have our days, but for the most part, in a way, I'm not one of those people who will say thank you to cancer, but I do acknowledge that it can have it can have a positive effect too, where it makes you, when we face our mortality, whatever it's from, it can give us more of a targeted mission to do good things, live our lives, and
Be wild.
live wild.
Be wild. That's my
Who
motto.
said that?
Gary, be
Be wild.
wild.
Well, and I think
What do you say?
coming through,
You don't worry about what other people think anymore.
That's Jerry, our wild and crazy guy.
Just be wild.
coming through some really harsh treatments and coming out on the other side and being okay really makes you appreciate life.
Yeah.
I always say, I think I said it last time, we do hard things. We do them every day. We can do hard things. And even though it may not be, oh, we have active therapies that we're going through, but even those, let's face it, if you have hematological type cancer, it doesn't matter if you're in the middle of a stem cell transplant or a CAR T or whatever treatment, that you have. It's the in-between times too that are not always fun. You can be not taking anything at the time because you're in between treatments, but this isn't a fun disease. I mean, having, you know, cancer of the blood, there's fatigue, that doesn't go away often, and there's other side effects that from other treatments that you have that you carry with you. It doesn't always go away. So you got to find, joy. You got to find something that gives you joy. And for me, it's family and talking with others and sharing. But you got to find what works for you. What is your joy?
Otherwise, the anxiety will eat you up, besides the uncertainty and the anxiety. So you replace it with joy and hope. And well, what I like to call fact-based hope, not Pollyannish hope, fact-based hope, which is where we're living. There's so much hope in the pipeline. Yeah,
Absolutely. It's going to be hard to hear from everyone else what's going on, but we still have to move on. But those are wonderful thoughts here. And we look forward next month to hearing, because it'll be 4 weeks from today. And if you go you may be in the hospital. It depends when you go in, right? So I hope you join us no matter if you're in the hospital or not.
I'll take my computer.
I know you've done that
Well,
before with us. So
that's what I said a month ago, that Lou might be in the hospital this time.
I know. I
Yeah,
was
you
hopeful. I was hopeful. I'd like to get this started.
get it over with, right?
Yeah.
Barbell. So you were saying before, and plus for you, oh my gosh, is it 3:40 in the morning? Oh, you're muted. You're muted. Oh, I don't think you're muted, Barbell. I don't think I
Yeah, we can't hear you, Barbell. Unmute your.
I'm sorry.
Somebody must have muted me because I wasn't unmuted before. So, well, my problem is the Waldenström now, and my blood work is improving. The hemoglobin keeps going up, and the proteins are going down, but they're not in normal range yet. What I really experience, though, is also skin issues and joint issues. That's why I was wondering when Linda said she had the same thing. I don't have rashes that itch, but I have some funny blotches on my legs. They're kind of underneath the skin, but it's not petechiae. It's something else. I have to ask the doctor what it is. I think it might have to do with the Waldenström. It actually also started as an MGUS. And because it's a very aggressive clone that I have, it developed very fast into Waldenström. And they couldn't even test. The blood was so thick, they couldn't even test everything. They couldn't test, if there were mutations in the DNA or so. It wasn't possible. So we'll find out, because usually there is a change in the DNA. And well, I will see if they can do it now, because like the proteins are going down, so that means the blood is not that thick anymore. But that was kind of a surprise, I think that this clone was already here before, because I had like this burning feet syndrome and numb feet and numb hands, which you also get with this disease. Also, when you have MGUS, you can have that. And I think I had this before, but it showed up when they reduced the CLL clones. When that was almost gone, these are more fragile, they die faster. But the Waldenström, that is a very strong clone. It started to evolve, So I'm still on Brukinsa, and I probably have to stay on it. Maybe later when everything's in normal range, maybe I can reduce the dose so I can stay on it longer. I kind of want to avoid mutations. There is a new mutation with Brukinsa, which does not show up with the other BTKI. And it could very well be, if that turns up, that all the BTKs will not work for me anymore. And I'm not sure about the BTK degraders, which are new now. So I still have to do some research, I guess. But other than that, I'm doing okay. It's just the joints are still a problem, and the skin is a problem, and my ear infection hasn't gone completely yet. So old age and sickness, in other words.
Cordell, so the BTK inhibitors work for Waldenstrom's as well, right? I
Yep,
know. Yep.
especially the sanulputinib. They did some testing with this already.
Right.
And the problem was I was on venetoclax, and it reduced the CLL cells really great because it was mostly in the bone marrow. I had 90% infiltration in the bone marrow, and it went down to less than 5%. But then it didn't work anymore. But I only had it like 6 months, so that was not a rejection of the drug, but there were some cells which learned to avoid the therapy. I believe they are really clever. So when you change to another drug, it attacks the cells in a different way. So it might also reduce the CLL cells when it reduces the Waldenström, which is a good thing to do.
Which one are you on right now?
Brukinsa, only Brukinsa.
Well, so you could still go on, before you have to go to degrader, you can go on what Judy's on, the pirtobrutinib. Because
but it's not available here at the moment.
Oh, it's
not available. And I have to avoid this mutation, because if that shows up on the Brukinsa, I might not be able to get any other BTK.
Well, but it's a different BTK.
I know, but they said the whole class is probably not working anymore. That's what I heard, on a Zoom
Covalent or
with doctors, but they're not sure about it yet because it's still being tested. The dosing also, I mean, they're still testing, but they said that this might be the case. Dr. Shazan or something, he said that. There was a Zoom meeting, and he said that could be that the whole class doesn't work anymore if this mutation shows up.
But considered
they don't know when it shows up.
Class.
There are no data yet.
The non-covalent is supposed to be able to work even if there's mutations from the other.
Right.
The problem with the non-covalent BTKs, they also cause mutations.
Well, but what Judy was trying to say is, if you can no longer take the covalent, then according to studies, then you can go on the non-covalent.
Yeah, but probably not with the Brukinsa. That's what Dr. Shazan said. So
not the studies that I've seen or the doctors I've interviewed.
Yeah.
And Judy's actually proof of that.
Well, he said that because it was asked. They asked about the mutations. There was a presentation. I think it's available too.
Which mutations are you talking about?
There's a new mutation with Brukinsa which doesn't show up with the other BTKIs, and that seems to be an issue. But we'll have to see. I try to avoid it if possible.
You're saying that Brukinsa causes a new mutation?
There is a new mutation which shows up with Brukinsa. They have a different mutation. Same with pirtobrutinib. It has different mutations, and it can reduce some old mutations. It's really weird with these mutations. I really don't want to have this, but well, I guess they're still finding out. How
the drugs aren't that old when you think
about it. What they say too it's not clear because these mutations come at different times in different patients. So they cannot say, you take it like 2 years or 5 years or something, and then you be fine. But I have a feeling, I have to find out if that is true. If later you can reduce the drug, maybe you can avoid these mutations. You know why I have this idea? Because when I take natural substances, after a while, I have a feeling that it's not good anymore for me, and then I stop it. But if you take a chemo drug and you don't adjust the dose, it might cause these mutations. But I have to find out if that's so, But that might be so because my body reacts like this. I only have the blood cancer. I have no other issues, so I can really try it.
That's a great way to look at it. I only have blood cancer, right? I don't have any other issues. So really, and that's a,
Yeah, that's why I can work on it really good. If you have other more comorbidities, it's a problem because you take other drugs and you don't know what causes what, and the interactions are not clear between the different drugs. So it's a bit easier for me, and well, I try my best.
how are you feeling?
Oh, I'm not feeling bad. The problem is I'm still not that flexible with my legs and everything, and there's a couple of things I can't do. But well, that's the way it is. I've been in a hospital half a year, and I think when you're as old as I am, it takes quite a while, until you recover. It doesn't go that fast, and the main problem was also these bacterial infections in the blood. The Staphylococcus aureus, which is a very dangerous one. It can affect the heart. It can really do some damage. I think I had over 80 antibiotic infusions. I probably exist only from antibiotics. But they couldn't start the treatment until these bacteria were eliminated from the blood. That was the problem. And my hemoglobin kept going down. And I said, oh, I hope the bacteria go first so they can start the treatment, and it did work.
Well, Barbell, we appreciate you staying up till 10 minutes to 4 a.m. to be with us. I can't even get my wife to stay up till 9 o'clock to be with me.
But Barbell is here for you, Lynn.
Well, I'm in the writing class too. It's also around this time, so it's 12 o'clock. I put in my bio too. Nancy, did you?
What writing class? Is that the AnCan one?
Yep.
What night is that on?
That's next week. I got a letter today asking for the bio.
Darn, I missed the start of that. It already started, right?
Yeah, but
you can still join, Michelle.
Yeah.
That's not a problem
Thursday.
because the first one was just getting to know each other more or less.
Yeah, 2 hours earlier than this call.
I'm gonna sign off because I have promised myself that I'm not gonna get overtired and relapse because I'm finally starting to feel better. So it was lovely to meet you all, and thank you for inviting me, Michelle. But I am going to not get overtired. I'm so excited that I'm committed to really honestly not getting
I'm glad you are. Our next so that you know, the next meeting is on April 4th.
Okay.
No, April 3rd. Sorry, April 3rd. Okay. The first Thursday of the month. Linda, if you want to mark that down, and everyone else as well.
That's my first doctor's appointment.
That'll be a good night. Thank you, Ruth.
Thank you.
Barbara, are you still doing physical therapy?
Yes, I do myself a little bit, so I stay fit because I'm sitting more than I should probably, but I have these joint aches and everything, and well, the mobility is not that good. I cannot walk stairs, and it's not that easy, but I get around. I have someone to help me. My neighbor, she comes once in a while who helps me. I have Meals on Wheels, so I have someone who does the shopping for me. My son does the paperwork, which is enormous in my case because I have two insurances. And so I'm actually fine. I just have to recover somewhat. But now that the proteins are going down, I'm kind of happy because they can do a lot of damage. They can harm your ears, your eyes, your lungs, everything. Because this IgM molecule is very, very big, and it causes a lot of problems. But with MGUS, it's not that high. The protein is there, but it's not that high yet. It started with MGUS with me, but the Waldenström, that has a lot of proteins, and it has to be reduced then. But what I also looked up with the myeloma, there are different myelomas. There is a kappa myeloma, and there is also a lambda myeloma, which I didn't know.
Oh, you're learning.
Yeah, I'm learning.
You're always a student, though. This will keep
Yeah,
you young.
I mean, I asked myself a question and then I read research. That's the way I learn.
That's great to know. So, in case anyone else wants to know about the writing class, you're in it, Barbell. Who else is in it? Nancy?
Yep, that is on
Lynn?
Thursday next week. It's again, well, my time it's 12 o'clock at night, but your time, Eastern time is 6 hours less than it's 6 o'clock.
6 p.m. Eastern, 5 p.m. Central.
So, I don't know if this is still the case. Is Germany turning their clocks ahead this weekend?
No, that's another problem,
There's like a week or two difference there, right? Where you don't.
We do it in the end of March, so it's still a while. But I think you do it on the 6th of March, right? So
we're doing it this weekend.
This weekend.
And
so
I remember that from doing
it's different
then
too. It's different times then for me.
So yes, that's why I was
1 o'clock then for me, I guess.
Okay.
If it's 1 hour later, then it's 1 o'clock.
Okay. That all sounds great.
I tell you, these summer and winter times, that's always a bad thing to do because I'm usually late then, because if I forget, I come when the meeting is over. They say, oh, okay, well, we had it already.
Well, Barbell, I hope you continue to get better. I will see you at writing class next week too then, and a lot of you ladies, but I know that we still haven't heard from Lynn, Mary Lou, Judy, and Nancy. Oh my gosh, we got to get through all of you quickly. I'm so sorry. Okay, so, and Mary. Oh, we lost Mary. She said she didn't need any time, but Lynn, I know you need time. Mary Lou, you said we'd love to hear your latest.
Okay.
How you're doing?
I'm doing well. I'm doing very well. I'm still in the clinical trial, which will end in September. So I'm on Vidasa and venetoclax every 6 weeks. And I'm doing well. I'm 100% my donor's blood and bone marrow. And there's no evidence of disease in my last bone marrow biopsy.
Ooh.
So I have another bone marrow biopsy April 2nd because I'm on the clinical trials every 3 months. So it won't be my 30th, however, it'll be my 31st. It'll be my 7th. But yeah, I'm very, very happy. Feeling much better. I just wish I could get out. I just wish I could get out of this house. I'm stuck here till September, a year.
It's stuck here for several years already. So that's
and I
nothing,
keep my
Mary.
clothes on mine. I
You
lost
can
40
your
pounds.
writing room.
Well, summer's coming. At least you'll be able to be outside of your house.
Yes, I can get outside. Yes.
And you see your daughter, is it?
Yeah. I don't see her as much as I used to. You know, I see her occasionally because she's always with people. She's special needs, so she's in a program. So, you know, she's always with somebody. So,
That
be
makes it
very careful. Yeah, yeah.
Well, it's wonderful to hear that. Do you still have to go and live in Boston each month for a week?
No, it's I go every 2 weeks now to Boston. When I start my fourth cycle of my clinical trial, I have to do the first day in Boston, and then the next 4 days I do locally. So that works out really good.
Oh, good. And when
Yeah.
is that?
April 2nd.
Oh, so that's okay.
Yeah.
So April 1st, you do your bone marrow biopsy?
No, I'll have it on the same day.
Okay.
I got a busy day that day. I got the blood test, a doctor's appointment, bone marrow biopsy, my chemo, and a pulmonology test. I think I'm going to change to pulmonology test.
That's a lot.
Yeah, because I won't get out till 7 o'clock, and you know it's a 2.5 hour ride home. So, you know, it's like forget it. We'll change to pulmonology.
And then you still have to go back the next day, right? The next few days.
Yeah, the next day I go locally.
But still,
yeah.
You don't want to be exhausted.
No, I know. No.
Wow.
So yeah, so I'm happy.
And now you're receiving continued treatment to ensure that they've really that you keep it down. You go into a deep remission.
Right. So I don't relapse. Yeah. Yeah. So far so good. I take one day at a time.
You know, that should be our saying too, huh?
Yeah, it's not easy.
You sound very good too.
Thank you.
How's your nausea?
Oh, it's good. Yeah, I don't have it anymore, so that's good. Yes, that was a killer.
Okay. Well,
thank you.
Be thinking of you then on 3 weeks away, 3.5, almost 4 weeks away.
Yeah.
So if you can join us on the 3rd, if you feel up to it, even just to pop in and let us know how you're doing.
Yes, I will do that.
And you get to go home at night that week, right? Because it's local.
Yeah.
That's good to hear.
Yeah.
Nancy, yes. You said you didn't need time, so all is good?
Great. Everything's really good. And Mary Lou, if you're stuck inside, you should join our writing group.
I know. I was thinking of that when you were talking about it.
It's
on the 13th, right?
Yeah, it's on the 13th.
Oops, sorry. That's my alarm to take pills. Speaking of medication, you know.
I'm going to write it down.
How do we sign up?
I think Alexa probably can hook you up because she's the girl. She's the one.
Yes, I can add you to the list, but you don't have to sign up. You can just drop in like anything else.
Okay. So is it via Zoom or GoTo?
It's in the same room that we are right now.
AnCan Schmier.
Yeah.
So Barbella, when you hear when she reads, like we had to write bios and we had to write them, you know, as if to ourselves, but they're going to read them and see if we can guess who they are. So Barbell, if you hear one,
for me it's easy. If I say Geisling, they know already who it is.
If you no, because my name's not in my. If you hear one that says "one day at a time,"
but now that could be any of us after tonight, right?
Yeah, if you get your bio in.
Okay, I have to add this into my calendar right now. So Judy, how are you doing?
I'm doing fine. I've just finished the year on pirtobrutinib. I'm a little, anxious as anybody else because the median of doing well on the Pirto is 18 months. So I'm hoping that I'm not on the last 6 months of this. I'm hoping it'll keep on working. My numbers on blood kind of seesaw back and forth on my red blood count and my platelets, and then my IVIG or the IgG has continually going down almost 100 points a month. But I started out at like 1800, which was strange. We don't know. I was on IVIG for over a year, and then off of it, and then my numbers went sky high, but they have gradually coming down. This time it's just barely over 600 for now. So we'll see what the next month holds.
Which number did you say that was?
It was almost 1,800.
Wow.
Yeah, which nobody really can tell me why it went up that high, but it did, and stayed there for several months.
All these crazy things, right? That, I mean, even these great experts we all go to, we're all so different, as I think it was Barbell who was saying that, but we are. Every one of us
Yeah,
is
an
yeah, that's
experiment
why they,
waiting to happen.
well, that's why they need to continue these genetic, diving deeper. They spoke at ASH about that,
Yeah,
about I've forgotten what country this gentleman was. It was a young guy who spoke about how they're looking for more, genetic markers. Obviously, they're diving deeper and
yeah,
to find that, which obviously they need to if we're all so different, right? Why?
yeah.
So I'm surprised more aren't doing that.
That, and I'm still doing my uh, melanoma screening. I'll have an ultrasound next month with that from having the melanoma surgery last April. So
they do ultrasound on that then.
well, I've done MRIs and I've done CT scans, and I had a CT scan in February, and it shows clear of that. And but I see the dermatologist every 3 months and the head and neck surgeon who took the melanoma out every 3 months, which they joined. So I'm seeing one or the other every 6 weeks. So.
Every 6 weeks, is that the protocol?
Well, for at least a year for the head and neck surgeon, and then my dermatologist, because I have so many abnormal things, we go to every 3 months. I see the dermatologist.
That's wonderful follow-up.
Yeah.
I did not realize that imaging like that was needed for melanoma.
Yeah. Well, they want to be sure it hasn't spread. And one of the things that happened was when they were trying to do the markers on the lymph nodes before I had the surgery, they put isotopes in it and then do CT, and they were doing it for like 2 hours and never could find anything. And they said that was probably because of the CLL that it didn't show up.
Wow. That it didn't show up.
Right.
I would have thought it would have lit up.
Yeah, which, they also tested it after, they took it out and didn't find any in the lymph nodes. But they said that's probably why the lymph nodes wouldn't show any reading, was because of the CLL.
But was it in the lymph nodes, or they don't know?
No, it wasn't in the lymph nodes, thankfully. But that was then after that is when I also had the liver biopsy, thinking that the spots on my liver might have been the myeloma. I mean, not myeloma, the melanoma. But again, that was just CLL spots, which, you think, oh, it's just CLL. Well, it could be worse. At least it wasn't the
And
other.
do those come and go?
I've had spots that have shown up on liver and on breast imaging, both, and both times they've determined them to be CLL spots. And Dr. Awan says, it's a blood cancer, so it's going to be throughout all your organs.
Yep. Yeah, I've had them also on both.
Yeah.
So, that's why with coaching, I always suggest that CLL patients tell when they go for a mammogram.
Right. Yep. absolutely.
And it's still a lot of those who work in imaging don't even still know what that means.
Yeah. Yeah, because the time that I went and they took me back and I had probably 20 more pictures. And then after that, then they did an ultrasound. And even the head of the ultrasound was not sure. And I said, if you will look, 6 months before I had a CT scan and compare it with my CT scan. And when he did, he decided that, yes, it was the CLL.
Still, so many don't know, understand.
Yeah.
But they don't look, and the other thing is they don't look at charts anymore.
Yeah, well, it's circulating in your blood. It's going to be everywhere.
Well, I'm glad that everything's looking good. And I'm sorry, when is your next CLL appointment?
The last of March.
And so are you off your drug, or are you going off, or how?
No, I'm still on it. And thankfully, I don't know whether, I think I said the last time, thankfully, that was my first prescription this year. And because I'm on Medicare, I paid my $48 copay, and I now pay nothing for the rest of any drugs that I take the rest of the year.
You have a supplemental plan?
Mm-hmm. Well, but you have, after $2,000 out of pocket on Medicare, what did that happen?
You have balloons there?
I don't know what that was. But after
Lynn, did you do that?
I don't know what I didn't do anything.
I'm gonna have to go soon and take my pill. Wow. I don't know how someone did that, but that was cool.
Yeah, it was cool. Anyway. But so anyway, after $2,000 out of pocket, then you don't pay anything for the rest of the year for your medication.
Thank you, Joe Biden.
Yes, absolutely.
So that's the new benefit, right?
Right, exactly.
Yeah. The other thing is we probably need to be proactive with AnCan and everything else. I went to a melanoma thing on Saturday and at UT Southwestern, and the doctors were saying that they had gotten a letter from the president of the university that with all of this cuts and everything that's going on, that they stand to lose $90 billion. The
university.
Mm-hmm.
Yeah, it's nuts. They're cutting cancer stuff all over the place.
Yeah.
Oh yeah.
So we really need to be proactive with that.
Dana Farber, and I don't know if it's just and I have to find out. I haven't seen my doctor yet, but my co-founder of Kicking Cancer and Heals, her doctor told her they're losing, I believe it was 34 million just there, except I don't know if that was just for blood cancers or the entire institute.
The entire institution was 90 billion. They don't know that for sure, but the president sent letters to the doctors informing them that could be. Of course, not all of their funding comes from that, but that is a big concern.
But I'm hearing they're reconsidering the NIH, the cancer funding stuff. I just think I just read something this morning.
I hope so.
They're taking a second look at restoring that, because it's just really coming under the what the fuck.
Yeah.
Be nice for everyone to learn if funding will be turned back on the spigot.
Just to be proactive to your congressman for sure.
Yeah, the problem is Congress isn't involved in it.
That's very true.
So you got to write your you got to write your judicial.
Oh, Jerry's saying something. We can't hear you, Jerry.
Oh, you got to write your judicial. Yeah, it's in the court system. So the court system's going to go through this. because Congress they appropriated it. So just somebody can't come in and say, no, you can't cut it.
Right.
You just can't cut it without congressional or Senate approval. You can't get
Right.
rid of it, or you can't cut it. So
Yeah.
it's going to do the court system. Problem is then you cut it and you lose all those people, and you can't get the people back, even if you get the money back. Then what do you do?
Yeah.
That's the catch-22 of it. Because you can whack them, but restore the budget. But if you lose all their email addresses, just like the nuclear people or the bird flu people, you don't have their email addresses anymore. How do you get them back? If they even want to come back.
Well, I've got a medical story we can close out with, since I'm the last one. I don't know if y'all may not have heard about the researcher from Boston that came down to Texas, but he came down and went out on Nancy and Jay's ranch. And their ranch extends, it's bigger than Rhode Island. And it just goes on and on. And so Nancy's husband, Jay, and he's a medical doctor, he took this researcher and they went, this researcher's researching about the cowboy way of life. So Jay took him out there and they rode the fence lines. They rode all day long. And at the end of the day, they pulled off and got their bedrolls out. They fixed they'd shot a rattlesnake and Jay skinned it and they cooked that rattlesnake and they had that for their evening meal. And then the next day they continued on and the sun bearing down on them, their skin was peeling from the sunburn and their lips were peeling from being chapped by the wind. And then on that day they had a rabbit for supper. And then the next day as they're riding along, the researcher from Boston noticed that ever so often Jay would reach down and get a little bit of cow patty. Now, cow patty is what comes out of the back end of the cow and plops on the ground. And he would reach down and Jay would get a little of that and smear it on his lips. And so kind of like us, wondering what is this medicine that you're using? Does that cow patty, is that good for treating chapped lips or what? And Jay said, well, I don't know if it helps the chapped lips, but it sure keeps me from licking them.
Can y'all tell he's from Texas?
Love the story. Lynn, you have an appointment coming up.
Next Wednesday.
How
And
you-
I'm feeling fine. For anybody that's a newcomer, my disease is small lymphocytic lymphoma, which is the same disease as CLL, chronic lymphocytic leukemia. Under the microscope, they're the same disease. One of them, though, is in the lymph nodes. That's the disease I have. The other was primarily in the blood. And I'm on a drug holiday, 2 years since I've stopped taking my cancer drug. And so we're hoping maybe go another year or two before I have to start up again on some kind of treatment.
Yeah.
But I'm doing just fine. And, my wife puts up with me. It's a difficult life for her. But anyway, I feed her every day. It saves our marriage. And she falls in love with me with every meal. It just gets kind of tough between meals, though.
I think your wife should come to one of our meetings someday. We need to ask her if all this is true.
She's right there. Shirley, say hi to him.
Hello.
Hello.
Hi.
Hey, Shirley.
Nancy says, hey, Shirley.
Hey. Oh, look at you. You tucked her in.
Yeah, she's about to go to sleep. Soon as when I roll over to give her a kiss in her night, she'll be snoring instantly.
So I looked up on, of course, the AI chatbot or whatever, and it said that if you hold your fingers up like that, it's supposed to trigger the balloon thing, but it's not doing anything.
I don't know.
Did you do that, Judy?
I didn't do anything.
Oh, that's what I was thinking. I don't remember
Oh,
Judy.
I don't know how that got there.
Did someone do that? Alexa, did you do that?
Did not.
Lynn didn't. I didn't. I'm just
I
trying to
didn't
see if we
either.
could we do it. I don't know.
I've seen that done before, but I don't know.
I've done it on text messages, but never on.
The only thing I've ever
I haven't figured it out, but that'll be a good homework assignment till next month. I'll try and figure out how to make our balloons go off.
Judy, you did it. Magic. You see, you just did it. You didn't know what you were doing.
It was
Lynn,
divine.
Well, I want to thank you all for being here. I hope to see you on April 3rd or at writing class. And maybe we can all figure out how to do the balloons. And pill time. Cheers, anyone. I know a lot of you have appointments. Oh, do I actually? I have my quarterly appointment in, I think, 2 weeks. So by the time we all see each other,
We'll have all gone to the doctor.
I don't know. Nancy, will you've gone to the doctors as well?
Not till May.
That's an okay thing to be left out of.
Yeah, I'm okay with it.
And Jerry, hopefully you'll be better when we see you
I
on.
won't see my oncologist till July, but
hopefully you won't be coughing or wheezing. You'll be back biking
someday.
Linda, thank you for joining us. We hope to see you. It was great meeting you, and I look forward to learning more about Schnitzlers. It's one that I've never reported on, so I started looking it up when you were speaking. You're lucky that you have great doctors there. Good luck, Lou, and everyone else. Mary Lou and Mary Lou, and Barbell and everyone here. We'll see you next month. Take care.
Okay.
Thanks, Alexa.
Bye.
Bye.